I'm back. So it's been a while since my last video. I think my last video I was talking about my update on the injections that I had. I had injections in my cervical spine as well as my hip, my left hip, and my sacral area and lumbar discs 4 and 5 area. Fast forward now, I am back in America, and I bought a home in my hometown in the Virginia Beach, Hampton Roads area of Virginia, which is also my name. And on October the 19th, I had a cervical discectomy here, anterior cervical discectomy with fusion. That big scar there, that's my old scar down here. So this was my second fusion. I did not want to go through with it. I really didn't. I tried everything I could to try to avoid having surgery, including the injections I had on my previous video overseas. But the pain got so unbearable and I was just uncomfortable. I couldn't work anymore. I couldn't do anything. I was pretty much kind of just like bedridden and in my recliner. So I made a drastic step and I changed everything about my life, including where I lived. I left the Middle East, Bahrain, and I moved back to America. So I'm in my hometown, Virginia Beach, Hampton Roads area of Virginia. So I'm back. And then on October the 19th, I had the surgery and I had to wear this thing for 4 weeks. I wanted to kind of update my YouTube, but it was so much going on because, like I said, I moved across country. I had to buy a house, had to buy a vehicle. I had to get acclimated to being back in America, and I'm still not acclimated to it at all. So a lot of life changes, you know. My husband came back for 2 visits, but he had to go back to work overseas, and so it's just, life just kind of came at me really, really fast. And it hasn't been pleasant. So I've had a lot of depression, a lot of anxiety. This surgery had more of a mental toll on me than it did physically. Of course, physically it's uncomfortable and, you know, wearing the brace, it was just a lot. But mentally, I had a harder time this time than I did last time. Last time it was more physical. This time it's definitely much more mental because you have to throw in the fact that I moved. I can't work. I'm away from my life as I've known it for 5 years. You know, so it's been a whole lot to take on. So I'm trying to get acclimated to my life back in America. It's not easy at all. And so that's my struggle. And to add further problems to that, I'm having a L4, L5 discectomy coming here December 23rd or so. That Sunday, a few days before Christmas, I think is when they have me tentatively scheduled for surgery. So that's what's going on with me. It has not been pleasant. So I did not want to do the documentation this time like I did last time because mentally I just really was not in a good place. I'm still not in a good place, but I feel like I owe it to people who are probably wondering what happened. She had these injections and she hasn't updated anymore, you know, and I don't like to feel like I'm leaving people hanging. So for the 5 or 6 people that watch my channel that might be wondering what happened, that's what happened and that's where I am at today. And I'm thankful for the little handful of people that do send me messages and inquire about my whereabouts on YouTube. And currently I'm not even on Instagram. I'm off of, and I've been off of Facebook. I'm kind of like, when I get like this, I just kind of go into myself. And I think it's really important that when you're going through some things, there are times you have to unplug from a lot of excess stimuli and a lot of unnecessary information about other things, other places, other people that just simply aren't serving you where you are. So I needed to go within myself and fight back and learn and try to process all of these changes that I'm going through. So I'm having a lot more good days than bad days emotionally than I was. But you know, it's a lot to go through, you know, and I'm 49 now. So, you know, the older you get, the harder it becomes to heal and to adapt and to just constantly go through these traumatic physical and mental experiences. So, and PTSD comes in many forms. You know, it's not just for people who've been to war or have been attacked in some way physically or emotionally. I believe it also applies to people who are chronic pain patients who have issues that they constantly have to have surgery, or they don't have energy because of their illness. It's hard to explain to people, like if they invite you somewhere December 16th and they call you today, most people will say, sure, I'll put it in my calendar. Well, we can put it in our calendar, but that doesn't mean we're going to be there. You know, it's kind of on a day-to-day, even second-to-second, minute-to-minute basis when you deal with chronic pain, the aftermaths of surgery, or depression or anxiety, whatever it is. You just can't really make plans like other people. So, you know, it's kind of isolating at times and insulating. But you know, you have to do what's best for you. So, and what's best for me is kind of being in my own space and being very selective on who I let in, what I let in, what I intake and digest. Because my mental health and physical health is paramount, you know, to me. So I'm doing everything I can to just stay positive and take care of myself. And I encourage you all to do the same, especially during the holiday seasons. You're not obligated to go anywhere, do anything, cook anything, be where. No, you're not obligated. So if you feel like you are, free yourself from that and take care of you. So that's all I have for now. And I will try to come back on a weekly basis. And like I said, try, because it depends on how I feel. But as always, my email is listed down under some of the other comments on my previous videos. And I do answer every email. So take care.